some of the typical questions that people ask. Does it hurt? We numb up the eyes before we do the procedure so we can eliminate the pain sensation, but we can't eliminate the pressure sensation. So you will feel some pressure during the procedure. Most people tell me that this feels kind of weird, okay? Very few people, and I maybe like 2 or 3 people in the several thousand that I've done in the past, say that the pressure was uncomfortable, okay? But not painful. Well, the surgery takes about 4 minutes an eye, and that's it. You're at the center on the day of the procedure for up to an hour and a half, but when you're in the operating area, you're in there for maybe 10 minutes. And the procedure itself, like I said, takes only about 4 minutes per eye. How soon after the procedure will I be able to see? Well, the answer is you're able to see right after the procedure. Okay? Things are blurry, hazy, vision may be foggy, it may look like your contacts have been in for too long, but most people, as soon as they sit up from the bed, they notice an improvement in the vision. It's still foggy, but it's still better. They can usually read the clock from across the room and so forth. Another typical question that I hear is, when can I return to work? For LASIK, almost everyone can return the following day if they desire. I kind of like to have my patients take a day off if they want to, so a lot of patients will schedule on a Thursday or Friday so they can have the weekend to recover, but you know, most people are able to do all that they need to do the following day. Another typical question that I get is, what's the age range for laser vision correction? The youngest that you can have it done is 18, and you could have it done up until, there's no upper age limit for laser vision correction. Generally speaking, most of the people that we see are between 18 and say mid-50s, mid to late 50s. The average age for people having this done is about 39. Another good question that people ask are, what are the side effects? The most common side effect is dry eye. Some people have some issues with glare and halos at night, especially during the healing period. Another question I get is, how affordable is the procedure? If you compare the cost of the procedure to contacts or glasses over a lifetime, it's actually much less expensive than contacts or glasses over a lifetime. You can break the payments down into monthly payments. We have options with Care Credit, and there are other credit options as well if you desire. In order to be a good candidate for LASIK, you need to be over 18, you need to have a stable eyeglass prescription, you have to have healthy eyes with no ocular diseases, and it's also very important that you understand what LASIK can and cannot do for you. The best way to determine whether you're a good candidate or not is to come in for a free LASIK examination. The fact is, 15 to 20% of people are not even candidates for LASIK. So there are lots of people out there who are wondering for years and years whether or not they should go through with LASIK surgery and worrying about whether they should have this done or not. And they can come in, and if you're not a candidate, at the very least you can just stop worrying about whether you should have it done or not. Another question that I get is, what's the success rate of laser vision correction? Across the world, 95% of people rate their satisfaction is satisfied or highly satisfied. Another question that I get are, what are the benefits of LASIK? Well, it depends on how satisfied you are with your contacts or glasses. If you're perfectly satisfied with contacts or glasses, I would not recommend LASIK for you. In terms of safety, if you have problems with your contacts, if they give you red eyes, or if you're overwearing them or sleeping in them, the benefit of LASIK is that it actually will protect your vision, because you're taking risks with your vision if you're overwearing or abusing your contact lenses. And I am here to do everything in my power to make your success rate 100%.